get two informations, layer and fiber direction.
네, 두 가지 정보 계속 기억하면서 하겠습니다. 어느 층에 있는가랑 어떤 결을 가지고 있는가.
I know we stay now in the fourth level deep.
여기서 이제 네 번째 층까지 가면은
So I have to get the information from the reference points to know where the muscle lies.
이 기준점을 이용해서 어느 곳에 근육인지 알 수 있습니다.
For obliquus capitis, inferior, we have here SP2 to TP1. And then I see it's a muscle in the U system, very flat. Okay.
V 시스템을 갖고 있지만은 굉장히 좀 평평하게.
And I visualize this connection between my two fingers.
이 시각적으로 한번 상상을 해보는 거죠. 손가락 사이에 이렇게 있다고.
And then I know there is first level, second level, third level. But if I take now all the three muscles of the first, second and third level and I go laterally of the semispinalis, I see I'm very close to the fourth level and you can reach it very easy here. So please don't start here, don't start laterally from the semispinalis muscle. Then you will reach it best. Then you have just the semispinalis capitis which overlies this muscle. This is a thin muscle and so here you reach very often to palpate the obliquus capitis inferior. Okay, so I go deep with my finger, I stay deep with the pressure and then I move perpendicular to the fibers of the obliquus capitis inferior. Then I release a little bit, I go in the fiber direction of the obliquus capitis inferior, I go deep and I go again rectangular. And then I can very often feel there are fibers in this direction and this must be the obliquus capitis inferior. Okay, and then I go in the direction medially and you see I can move away a little bit this longus, this semispinalis, and I perform the same task. And so I make several provocations and I ask, is it equal on every provocation side?
다 누를 때마다 같은 동작이에요.
Is it equal every side? More or less.
Under pressures.
Here was more.
Yeah.
Okay. And so I'm looking again for the side which is most painful. Second criterion. And then I continue, and here I have to go through all layers of the muscles, okay, to provoke. This is obliquus capitis inferior. Then I continue, obliquus capitis inferior, and from here, from PT, directly behind the process mastoid, there is this obliquus capitis superior. Those are the reference points. PT1, dorsal of processus mastoideus. And then I know this direction, I'm dorsal from the SCM, and I go here profound, deep. I rest deep, and I go perpendicular to this muscle. And sometimes you can feel it there. Dorsal from the SCM. It's okay? If you can't feel the muscle, it will not have trigger points because he has no taut bands when you can't feel it, so it's no problem. But if he has trigger points, he has the taut bands and you can reach the muscle easily. Then, for the rectus capitis posterior major, I take here SP2, and I go here again dorsal of the processus mastoid, here and the occiput. And I know this is the direction of the rectus capitis posterior major. I don't feel the muscle, but I know here profound it has to be, and a little bit higher and medial must be the rectus capitis posterior major. So my vision is I see here a triangle here, here, here. And this line of the triangle, which is rectus capitis posterior major, and then in the middle of the triangle will be the rectus capitis posterior minor. Okay. And if I have these reference points, then I go on this muscle and I make the provocation on 2, 3, 4 sides. It's okay?
Yeah.
Slowly, 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 slowly. I go deeper and deeper and deeper. Then I release. I go on the second point. It's okay?
Yeah.
I go on the third point. It's okay.
Later.
Huh?
Yeah.
It hurts here more.
Later.
Okay. So I'm looking for this. Is it equal each point or is it different? Okay. And I saw here little pain, and here more pain. So I'm looking now here for the active trigger points. It's okay? It hurts.
Again.
Do you know the pain?
Yeah.
Yes. Oh, this is great for our experience. And like this, it hurts or it doesn't hurt? Not anymore. Okay. So I know I can provocate this pain, making this pressure. And again, performing this pressure, I have pressure, but I have also a movement you can recognize, a movement in the cervical space. So I don't know, is it probably an instability? And then it would be forbidden to mobilize here in this region. So first I have to know, is it the pain because of the movement or because of the pressure? So I go in this area and with a flat grip I move, and you see I move more than before. Does it hurt now? No. Now I know it's not the movement the problem. If this would be painful, I wouldn't touch anymore, because I don't know what is the reason that this movement creates the pain. It could be an instability or a fracture of here from atlas, ligamentum alare problem, and I wouldn't touch anymore. I would call the medical doctor and give him the information. I'm not sure. There I have sign. I can't make the interpretation. It could be a severe problem. Please make the decision making. I can't perform this as physiotherapist. I know there are colleagues, they say, yeah, we have this test and this test and this test, and I think this is nonsense. Why? I practice this now for longer than 10 years. I never had a positive test when I performed like this. So I know this is very seldom. And I can't make a reliability of a test if I can't perform them daily. So all these tests concerning the instability in the higher cervical region, in my opinion, I can't prove them, I can't test them, I don't know. And the risk is too high if I make here a mistake. It can be very, very bad. So for me it's clear, I make this test, if it doesn't hurt, it's no problem to press, because the movement, there is no pain, I'm allowed to make this. And if the movement creates the pain, For me, it's too dangerous. I would say, please go to the medical doctor with the MRI and all the things. We can make wonderful diagnosis, and I make no risk in this area. Okay.
Maybe there.
Who needs a translation? Who wants translation?
저 통역 방금 부분에 대해서 앞은 다 해부학이었고. 저 이제 앞에는 해부학적인 그런 위치적으로도 다 이렇게 설명을 했었습니다. 그래서 그 다음에 마지막에 했던 내용들은 우리가 앞전 그 머슬 때 할 때도 이게 움직임에 의해서 통증이 발현된 건지 내 프레셔에 대해서 발현된 건지 모르니까 이제 모빌라이제이션을 통해서 테스트를 합니다. 근데 아까 상황과 반대로 이번에는 만약에 모빌라이제이션인데 지금도 아파요, 똑같이 아파요 하면은 당장 그만둬야 됩니다. 이게 이 부분에 대해서는 이제 로 선생님도 되게 많은 경험을 해봤지만은 한 번도 이 같은 통증이 모빌라이제이션 나타났을 때 진행한 적은 없었다고 합니다. 왜냐면은 여기서 뭐 인스테빌리티나 뭐 조인트 리가멘트 이런 문제가 있을 수가 있어서 바로 닥터와 상담을 해야 됩니다. 왜냐면은 이 부분에 대해서 근육이 아닌 문제라면은 엄청나게 위험 요소가 많은 부위이기 때문이라고 합니다.
제가 생각할 땐 그런 거죠. 왜냐면 C2SP를 밑으로 모빌라이제이션 시키는 거는 우리가 트랜스버스 리가멘트 테스트 할 때 우리 레드 플래그죠. 레드 플래그 했을 때 이거 했을 때 인스테빌리티가 있다는 거는 진짜 리가멘트에 문제가 있을 수 있기 때문에 닥터한테 보내는 게 낫다. 그때 통증이 있을 때는 자기가 하는 것보다는. 근데 이거 했을 때 만약 통증이 없다면 그대로 적용해도 된다 이 말인 것 같습니다.
Okay. So once again, for rectus capitis posterior and minor, I palpate the SP, and then I go dorsal from the
TP.
No. For the rectus, not I go to the processus mastoid, to the occiput. Yeah, this is important.
유양돌기랑 TP랑 구분해야 된다는.
For the rectus capitis minor, I have SP to occiput. From SP to PT is obliquus capitis inferior. This is very important. So I go to the occiput. I have this triangle. I provoke in several sides. We had here the. I can reproduce again.
Yeah.
Okay. Then I make this. This didn't hurt. And then with pressure, I don't know which layer, in which layer is the problem. So I provoke again. It's okay? You feel it?
Yeah.
Okay. And then I take everything I can with this pincer grip and I provoke too. Same pain?
No.
No. Now, where is this problem? In the fourth layer. Okay. It hurts also because it's a strong pressure, but it's not the pain he's familiar with. Okay. So I know I have to provoke in this direction. It arrives again? Okay. So I know it's rectus capitis posterior, major or minor, and I can go because I know now I am over the minor, it's the minor. Okay, then to finish, we will be ready.
그래, 제일 첫 번째 근육 할 때 옆불뛰기에서 접근하지 말라는 겁니까? 그 처음에 설명해 줬잖아요. 세미 스파이널리스 설명하면서 같이 맞아요?
그럼 할 수 있다는 거 아니에요?
할 수 있다는 거야? 할 수 없다는 거야?
가쪽에서 하지 말래?
가쪽에서 하지 말라 했던 거 아니에요? 그 다시 한번 물어봐 주세요.
지분의 표지가
제일 첫 번째 근육 할 때 우리가 그 C1의 트랜스버스 프로세스를 찾고 그죠? C2의 SP를 찾았잖아요. 요렇게 껐는데 얘를 찾을 때 가쪽에서 하지 말라는 말인지 가쪽에서 할 수 있다는 말인지.
When we're trying to calculate obliquus capitis inferior,
Yes.
is it okay for started from lateral side?
Yes, I proposed. For the obliquus capitis inferior, you start lateral from
Yeah.
this.
아,
Uh-huh.
I see.
For the rectus, he goes in this direction. You can try, but I don't trust that you arrive. And the rectus capitis minor you can't reach from lateral. So I propose just for the obliquus capitis inferior to start here, where you can be really lateral. And for the rectus capitis major and minor, I go through all muscles and then I differentiate in this.
Thank you.
Okay.